The definition of smile: a pleased, kind, or amused facial expression, typically with the corners of the mouth turned up and the front teeth exposed. Smiling shows moments of joy, happiness, love, strength, warmth, and shared communication. On the 6th of November 2019, that was the day that I lost my smile. I just turned 16.
So my name's Katrina Neville. I am the lead facial therapist at the Queen Victoria Hospital and also at the Facial Rehabilitation Centre. And I work in a multidisciplinary team helping patients with facial palsy for all sorts of reasons to improve their outcomes and recovery. Okay, so facial palsy is a condition that can be caused by many different reasons. So it can be caused by viruses, it can be caused by tumours, it can be caused by fractures in the skull, but basically they all relate to an injury that happens to the facial nerve after it exits the brain.
Hi, my name is Ellen Passmore. I am 19 years old and I took facial palsy when I was 16. This is my story. It all started on the 6th of November 2019. I first noticed the symptom of facial palsy in French class when my eyes started to water uncontrollably.
The first I recall was Ellen having just a common garden virus. She'd been hanging for the Halloween week and just feeling a bit low, slight temperature and a bit of a sore throat, nothing untoward. And then she was back in school after the Halloween week, and it was she seemed grand. But it was the Wednesday morning. I was dropping her off to school, and I was asking her if she was okay, and she said I'm absolutely fine. And there was like I don't know, I can't say exactly what it was, but there was something saying that something wasn't quite right. And I'd phoned you to say, like, make sure that you pick her up from the train station, because I still think she's not feeling well, but we couldn't really put my finger on it. It was just a gut feeling, just like mothers sometimes do, you know.
My friends thought I had an eyelash in my eye, but it wasn't. Dad picked me up and I got off the train. He looked shocked when he first saw me. He kept asking me questions, but I answered them immediately.
From the station?
Yeah, I picked Ellen up and when she got into the van, the first thing I noticed was her face. I thought it was a stroke. I'd witnessed my mother take a stroke, so I knew all the symptoms of it. So I started asking her loads of questions, and she thought it was crazy because I was asking her the most stupid, silliest things. And but she answered everything correctly, and sort of I knew straight away it wasn't a stroke; it was something different. So I went straight to the GP. After a bit of confirm between a couple of doctors, they quickly diagnosed Bell's palsy. And the next thing that had to be done was get to the A&E and get on a course of steroids, which we later found out was the correct thing. So when we left there, after all the checks, everything was, we will have to rule out this, that and the other. Ultimately, when we left, it was most people will recover. Can't remember the stats, but 3 to 6 weeks, don't worry about it, she'll be grand. And we sort of left there going...
While I was waiting to be seen by the GP, I was given a tissue by the receptionist as my eye kept watering. Once seen by the GP, I was told to do these facial expressions which suggested that I had Bell's palsy. She had another doctor confirm this diagnosis. I was given steroids there and then to take down the swelling. What I recall from A&E was get my bloods taken to rule out anything else, like Lyme's disease. The doctor's diagnosis was confirmed and it was Bell's palsy. I was given steroids, eye patches and eye cream. What I recall from the appointment was that I had to protect the eye and that I would recover in several weeks. I stayed off school for 5 days before going back. I vaguely remember the first day at school when people were coming up to me asking if I was okay. I remember people stopping and staring as I walked past. My teachers at Ulidio were amazing. Miss Bell would let me sit at her desk to do work. My friends were amazing too. Erin, one of my close friends, would put eye drops in my eye. I also had a few people making comments about my eye patch, call me a pirate. School was hard, but I got through it as I focused on work. I had 2 bad experiences at school. One was on the first day of sick form, when I had to get my photo taken, but it was taken on my bad side, and I looked horrible. That photo scarred me. My other bad experience in school was when a student in the year below me came up to me and asked, "Were you the girl with the eye patch?" My heart broke that day, because I didn't want to be remembered as the girl with the eye patch or the weird face. I just wanted to be remembered as me. After a certain amount of time, I found that my face hadn't improved. My parents set me up with a private appointment where I was told I had the worst level of facial palsy and that I won't improve. My heart dropped.
We were told to expect a referral to ENT
Yep.
in a fortnight. And fortnight came and went, 5 weeks came and went, and I'd phoned ENT and they had unfortunately not put the referral through. So this happened at Halloween, after the Halloween week, and it was December that she finally had got seen by ENT, and there wasn't much of a change in her face at that time.
Yeah, so we had been sort of looking for gradual improvement, which we thought would happen, but noticed that really there was nothing happening. So maybe I sort of thought maybe it was just going to come all at once.
Yeah.
Like that, all of a sudden there would be this dramatic improvement. But still going to that appointment in the ENT, we both weren't really expecting anything bad. It was sort of like, she'll go, they'll talk about it, and they'll say, yes, don't worry, this is going to change, and everything will be normal quite soon again. But that's not what happened. It was a total shock to the system. They can't remember the ENT specialist's name, but it just, this could be it. It's one of the worst Bell's palsy that you can get, and there's not a lot can be done about it. You've just got to let time sort of aid the recovery. Leave. I mean, I can't really explain it any other way. But both our reaction was, that can't be right. We had Ellen there looking at us for maybe answers, and we had no clue what to say to her. So we immediately went and got another referral, which is, as any parent would do. This can't be right.
Yeah.
Went to another referral privately, and he graded it from 1 to 6, and he says Ellen's palsy would be one of the worst, grade 6. It has really affected her face, and much as backed it up, said, there's nothing much you can do. But that was just before Christmas.
Yeah.
And we couldn't accept it. We then started hunting around, trying to find somewhere to get help. I quickly realised that in Northern Ireland, there's no help. There's nothing obvious anyway that we could find. There was no help. We went on the Facial Palsy UK website and got on Facebook pages to try and get advice. Facial Palsy website was fantastic. It was telling us about, trying to do exercises and trying to aid her recovery.
Yeah. After that, my parents researched to see if we can go elsewhere. At one point we were going to Edinburgh. That was until we found the Facial Palsy website, where I was educated on facial palsy. I was able to get in contact with Ally Hewitt, and she referred me to Shauna, where I went through massages and exercises.
My name is Shauna Farraher. I'm a speech and language therapist. I work for a company called Specialist Speech Therapy Practice based in Scotland, and I also work full-time for the NHS. Ellen was referred to me by a physiotherapist working in the NHS, and the first time I saw Ellen was the 21st of January 2020. She'd had the onset of her facial palsy happened on the 6th of November 2019, so she was a couple of months post-onset. So during the initial assessment, I did a really in-depth case history. So that included kind of the details around the onset of the facial palsy, the impact of the facial palsy on Ellen's social life, her attendance at school, her feelings around her self-confidence. And we also took photos, and we took photos then during every session to just track her progress. So during Ellen's initial assessment, we used a facial grading system called the Sunnybrick. So this is a tool which looks at symmetry at rest, volitional movement and synkinesis. It gives a composite score of 1 to 100, with 100 being what would be deemed as normal. I first met Ellen a couple of months post onset of her facial weakness, and although some volitional movement had already emerged, her recovery was prolonged, so we did expect to see some synkinesis, which emerged at around 5 months post onset. And from this point we knew that although she would make some really great progress, it would be unlikely that she would make a complete recovery in terms of normal facial nerve function. So Ellen's initial Sunnybrick score was 21, with both resting symmetry and volitional movement being significantly affected by her Bell's palsy. This score jumped to 62 on our second meeting, and then the Sunnybrick score just continued to rise with each session and plateaued at around 67 to 70 by the end of our block of therapy, which lasted exactly a year and comprised of 8 sessions in total. As more volitional movement returned, we progressed the exercises working on smile and eye closure alongside stretches to the unaffected side to reduce dominance. Eye care remained a high priority, and Ellen bought a pair of moisture chamber glasses to further help the dryness in her eye, which she felt were really effective. We also focused on rest and gentle massage at the beginning of Ellen's recovery, and then progressed to relaxation when tightness in the muscles began to emerge. We first noticed synkinesis 5 months post onset. The synkinesis was initially mainly noted in the left eye when Ellen smiled or puckered her lips. Stretches were introduced focusing on the tightest muscles, and dissociation exercises targeted the unwanted linking between her mouth and her eye. So overall, Ellen was very committed to her therapy program and recovery. For Ellen, I would say the timing of COVID-19 was a good thing, as it allowed her to rest, focus on her therapy and recovery, and meant that she could take her time returning to seeing her friends again. One thing that really struck me about Ellen was her resilience and her ability to adapt to what had happened to her. Due to the pressures on body image placed on young people from social media, they can really struggle to integrate back into school and socialising. However, I saw that Ellen just really took this all in her stride.
We started supporting Ellen with facial rehabilitation, and Shauna was absolutely fantastic supporting Ellen as well. It was great when she was doing face-to-face, and then of course COVID hit us and it was all via Zoom, but we kept up with it, we kept going.
Yeah.
And you were taking pictures as well throughout the process.
Yeah, so that was one thing that we found very helpful. I'd read a wee bit on the Facial Palsy website. I can't remember, it was one girl's story about her journey, and one of the things she had said in it was take a picture of Ellen at her worst, because that is your marker for where the improvements come from. So we kept going to that picture, we kept looking to her months down the line to see how she'd improved, and when Ellen seen it, it really encouraged her. So to anybody that's gone through this, please do that. It is very, very helpful.
But it was hard. It was hard looking at those pictures. You know, one of the things that COVID brought us was, was Ellen being able to be at home,
yeah,
and recover quietly at home. But then there was all that stress through the exams and the home environment. She sort of isolated herself in the house and isolated herself from friends and family.
Yeah.
But one of the things that she had asked me to do was to take down all the pictures that we had up of her as a little smiling girl. How, it was difficult for her to look at because she was just unable to smile. And that was, that's when I knew that she was really struggling. physically and mentally with the condition.
Facial palsy isn't life-threatening as such, but it's life-changing for Ellen. It's life-changing for us as parents with her, and how it affected her mentally, and all of us mentally. It just needs help. People need help when they have it, and they need help in Northern Ireland.
So there's many different causes of facial palsy. The most common cause of facial palsy is Bell's palsy, which is a viral cause, probably closely followed by something called Ramsay-Hunt syndrome, another virus. Ramsay-Hunt syndrome is actually the shingles virus that affects the facial nerve and causes facial palsy. So viruses are a big cause. And the virus causes inflammation, which compresses the nerve and stops the signal getting through to the facial muscles. That's how it causes the facial palsy. But there's other causes. So sometimes people will have a tumor, usually a benign brain tumor, but sometimes a malignant brain tumor that can be putting pressure on the cranial nerves and has to be removed. And sometimes when they're removing that nerve, the facial nerve can be damaged, it might be stretched or compressed. In the worst case scenario, sometimes even cut. So patients that are having to have quite invasive brain surgery can often get a facial nerve injury as a result of that.
My name's Lisa Smith, and my son Jamie was born with facial palsy. We found out first about Jamie was when he went into P1, and the teacher said to us about the shape of his face. She had Bell's palsy, so she said to me on the off chances, look, have you ever thought? We always thought it was a dummy. It always sucked from one side. And we had mentioned this to the teacher, and she just says, look, it might be nothing, but can you maybe go and see about it? So we did. We went to the doctors, and they wrote a letter, and then we went to the Ulster Hospital, who knew nothing about any of this, and they took x-rays and MRIs, and they sent them to the Royal. Then we got a contact from them and said if we would be willing to go up and see. There's about 4 or 5 doctors up in the Royal, and so we went up and they looked at it and they said that yeah, there was definitely something there, but they weren't sure what it was. So they were sending off the x-rays to Great Ormond Street to Professor Grobler, who is the main surgeon, and he's from South Africa and highly recommended. So then we got a wee phone call from the Great Ormond Street to say, could we come over and just have a look at Jamie? So we went over and we went through a lot of things that you never get in Northern Ireland. You would see the doctors, the physios. We went through and we got photographs taken all in one day. So they did, made him make faces and shapes, difference with his eyes closed and blown bubbles and stuff just to see what way it would react. They definitely said that there was something definitely wrong there. They thought there was no nerve and no muscle. So they were doing a lot of tests, and we got a phone call to say, look, would come over and have a discussion because it might be an operation needed. So we went over and we had a lengthy discussion, and we had to think about, was this the right thing for our son? Could we put him through this operation, which is a very long process. So we thought of him, who is autistic as well, and said, and later on in life, had he asked us, why didn't you do anything? Why am I like this? That would be on us. We would have that guilt. So we thought he was 6, and we thought he's young enough, we'll go ahead and do it. So we had to go through psychology as well with him before the operation, with him being autistic, and then the facial as well. Because Jamie didn't like to smile, didn't like anybody to look at him. You used to see him sitting looking in the mirror. Why am I like this? Why am I weird? It was all very emotional for him, so it was. So we seen a psychiatrist up in the Royal Children's Hospital, and she helped us a lot, and she spoke to him about what was going to happen through the operation and why they were doing this and that there. They also spoke to the school to speak to the children as well, because whenever he was coming back, he would have had loads of scars. So they would have to speak to the children to discuss with them as well why he was like this, just in case they were asking too much questions, which Jamie didn't want to know. But it helped a lot. It really did help a lot. So the first operation we had, he had to get a nerve taken from the bottom of the back of his heel, the back of his legs, and put into his good side to make it grow over before they were able to do that. So it took up to a year. And then we got another operation for the muscle underneath the arm and up to the back of his ear. So that was connected, which took 8 to 9 hours as well. A lot of scarring around here, and his eyes as well, because his eye didn't shut. His nostril was bigger than the other, and one side of his face just didn't move. So that's now a year. We don't see the psychologist anymore, so we don't, but it's still very emotional, because all he wants to do is smile, have a sweet smile. Why can't I smile, even in photos? And if you do take a photo and go, "Mummy, delete that." So it's a lot of emotional for him, and for even his bigger brother. He has to watch what he says as well. So we're going over again next week to see how it's progressing. What they're saying now is the eye is doing really well, but the face isn't lifting still, so they may have to do a wee stitch inside to give him that wee bit of lift. So it does, but he wouldn't talk to anybody, and he doesn't smile with anybody at all in case they make fun of him. So it's emotional for us and for the family as well. But coming on right now, and hopefully we've done the right thing. But it's just one of those things we just had to try for his sake and our sake, for his later life as well.
I got facial palsy as a secondary to Lyme's disease, which, so at the start, when this all started, I didn't know what Lyme's disease was, and I sure as heck didn't really know what facial palsy was either. I'd heard of Bell's palsy, but I really didn't know what it was. I was away on a business trip in Seattle about 9 years ago, and I had travelled through the night. I was trying to beat the jet lag by not going to bed, and it was really muggy, and I changed into a skirt. That's the reason for telling you this story. And I went out into town with a few friends, and it was very, very muggy. And I remember thinking, this is so muggy, and lifting the skirt and putting it above my knees because it was so warm. Everything was great. We had a great night out. I went to bed a couple of hours later, but because I'd missed 24 hours sleep, I slept like the dead and woke up, I think it was 15, 16 hours later. Yeah, it was a bit of a long sleep. And I noticed a massive, massive, great big bite on the right side of my leg, which I phoned home about and said, "You should see the bite in my leg." And that was it. I never normally got bit, didn't have the skin type, and just forgot about it. I just kept thinking I wasn't getting over my jet lag. I was exceptionally tired, and I remember about 3 days later I was out in a restaurant. It was air conditioned, everybody was looking for cardigans, and I was sweating, really sweating. Thought I had menopause kicking in, and I proceeded the rest of the trip sweating all the time. There's photographs of sweat all over me, and fatigue and joint pain. Just thought, ugh, you're not doing well with jet lag. Went home, went on a family holiday. First sign was I got car sick. Never been car sick in my life. And then fast forwarding to about 3 weeks later, after now excruciating joint pain, fingers, legs. Again, just think I'm tired, overworked, and I noticed something strange with the right side of my face. And I couldn't quite put my finger on it, what was wrong with my face. So I went to a friend's and she opened the door and I went, is there something wrong with my face? And she went, I think so. So it ended up in the out of hours. They went, oh, you have a Bell's palsy, but I need you to go to A&E. Off I toddled to A&E. And by this stage, the face had dropped a wee bit more. And they said, oh, definitely Bell's palsy. Here, have some steroids, which I now know is the right thing to do if you have a Bell's palsy, not if you have Lyme's disease. So fast forward 3 days later, my face is completely and utterly dropped. I think I'm going to die of a brain tumour because I've the worst headache in the world. And then I realise I can't use my arm or my leg. And I end up rushed to the Royal, and people think I have a stroke. People think I have MS. People think I have sarcoidosis. I didn't even know what that was. And then after all of the tests, I was told it's just Bell's palsy and a virus. Too long a story. Ended up weeks later being diagnosed with Lyme's disease. And then I had to fight for treatment for Lyme's disease, and that was a long, hard journey. But I have been left with a permanent right-sided facial palsy now.
Okay, so facial palsy can have a whole range of effects on the face. The facial nerve mainly supplies the facial muscles. It doesn't supply the sensation to them. So if you've got damage to your facial nerve, you'll still be able to feel your face, but it's the movement of the muscles that gets affected. So anywhere from the top of your face all the way down to some of the neck muscles won't be working. So you won't be able to raise your eyebrows up. You might not be able to close your eye or frown. Can't wrinkle up your nose. You can't show your top teeth or smile. You might not be able to pucker your lips, to whistle. Can't show your bottom teeth, and you can't sort of tense up your neck. And if people were able to move their ears before, they won't be able to do it afterwards. Not many people can do that though. Another thing that the facial nerve controls is the tear ducts and the salivary glands. So it can actually mean that you don't produce as many tears, so your eye can get very, very dry, and you might not produce as much saliva, so your mouth can get very dry as well.
Before facial palsy, I was quiet, shy and a timid person. I was never a follower and I kept myself to myself. I made a few friends and I was slowly coming out of my shell. I was starting to gain confidence until I took facial palsy. I always struggle socially, so taking facial palsy made me realise how different I was. Facial palsy has affected my confidence. It affects how I look at myself in the mirror. When I was first told about facial palsy, I thought I was going to recover and I didn't care about how I looked. So I took the stairs and people calling me names, and I focused on my GCSEs as I wanted to work harder for the career that I wanted. This all went downhill when I was told that I wasn't going to recover. I then started wearing hoodies to hide my face, and I stopped taking photos of myself as I hated the way I looked. As I wasn't able to fix my face, I focused on working out to lose weight. I guess the hardest thing was not seeing any improvements and not being able to hide my face, as it's the one thing you can't cover up. This led to avoidance in places that made me anxious, like large groups, and pushing away friends and family. Each facial expression you make shows an emotion. A smile can make someone's day, but I can't smile, frown, or do any other expressions. I'm self-conscious of my smile as it's lopsided, forced, tight and sore. Facial palsy has made me more blunt and has made me hide my emotions, as my face can't make any facial expressions. I also feel jealous towards other people who can smile. I'm trying hard now not to think about my face when out in public, but when the pain starts, I'm reminded of it all over again. I get tightness in my face and my eye waters in bad weather conditions. If someone were to ask me if I could fix or get back a movement in my face, it would be my smile. When I was younger, I would chew my teeth when I smiled, but it's the one thing I can't do now.
My name's Roy and I have facial palsy. So following an attack on myself in September 2020, not only have I've been left with a facial scar, but I've also been left with a facial palsy, or what I've been told is synkinesis. So it's basically every time I blink that my lip lifts up each time. I'm not just sure of the medical technical terms for it, but for me, the way I understand it is that following the attack, that some of the nerves on the side of my face were severed, and the surgeon was unable to reattach them all. And sometimes in the healing process, the nerves reattach, but maybe not necessarily always in the same place. So there's something just maybe not wired up again as it had been previously. So I'm left then with, at present, that facial expression, I suppose, it's not intended by me, and it sometimes can be a little bit overwhelming, can be very can have a lot of negative impact on my confidence, but that is improving. I think each day that goes by, there's more of a recognition, more of an acceptance around how I look now, and I think initially that was the biggest challenge for me, was to accept that life for me will never be the same, and that's the reality. But it's taken me now until sort of recently that I'm able to say that, and that in itself, I believe, is a sign of growth. That's, although it's slow, and I struggle sometimes with that, and being patient, being self-accepting, I think. Yeah. There's the physical side, yes, and there's also the emotional side, which I can't really. There's times I wish I could control it, but I find when I do try to control the emotions, which my facial palsy stir up within me, that it's more difficult. But I'm learning now to allow the emotions, allow whatever comes up. For me, that's where I heal from, that place of vulnerability, that emotional place within. Yeah, that's a journey. It's been a journey so far, but I'm thankful now. There was a time I wasn't. All I could see was how my face had changed forever. I don't have that mindset now. I don't have that attitude. I'm more of a place of, yes, that self-acceptance more. I'm not there yet. I have a bit to go, but certainly I feel stronger. I feel more focused now, and I'm getting close to the stage where this is me.
I was talking to my facial rehabilitation therapist, and she said that I went through trauma, and I never thought of it that way. She called it a traumatic event, which is a series of events that cause a lot of stress. She also made a point about your brain capturing your face at its worst. So this image is what my brain keeps reminding me of. I now need to retrain my brain to capture how my face looks now. You have to learn to see yourself through a different lens. I remember on my first day at uni when a man came in the classroom and said that all you have to do is smile to introduce yourself to someone and to make friends. I was like, that's not hard. And I could do that until I realised that I couldn't smile. And I was so disheartened. But I continue to have private physio sessions and I hope to continue making improvements. I feel guilty feeling sorry for myself as there's other people with life-threatening illnesses.
So my name is Charles Nduka. I'm a consultant plastic surgeon at the Queen Victoria Hospital in East Grinstead, where I lead the facial palsy service and have done since 2007. After we set up the service, we realised that there were lots of patients who had problems, but we couldn't really help. They weren't candidates for surgery. They really more needed information. They more needed support, and support that wasn't really able to be given by the hospital. And so in discussion with colleagues, and in particular Vanessa Venables, who was then a speech and language therapist, we founded Facial Palsy UK in 2012. So this year, 2022, that is our 10th anniversary year, actually. And initially the charity was pretty small. We were really lucky to find somebody called Karen Johnson who had her own patient information website that she set up herself, hadn't been born with facial palsy, and chatted this group from there. And our main aims were threefold. One, about providing support, a forum through which we could give information to help patients support themselves and support each other, research, and that was a way that we could ensure that we could create an evidence base that would help ensure that treatments were made available on the NHS. To inform, particularly to inform health professionals, because one of the big problems with facial palsy that patients face is that they see clinicians or other health professionals who don't really understand the condition and therefore give you the poor advice on none at all. So those three pillars are what underpin the charity: to research, inform, support. One of the problems with facial palsy is there's really uneven provision of services across the UK. So whilst there are some units in the southeast, for example, obviously our unit, which is in Sussex, and there are units in around London, there are parts of the country that aren't that well served historically, and that includes Northern Ireland, which, whilst there are excellent plastic surgeons there, a full formal multidisciplinary team, that's to say, includes both surgeons and therapists who have expertise both in facial therapy and speech and language therapy, and importantly in psychological care of patients. That has been a bit of a struggle, and so much so that we have had patients travel over from Northern Ireland to our unit in the southeast. I do understand that services are being made more widely available, and some new consultants are being appointed, which is fantastic news, because it does seem a shame if patients are having to travel long distances just for an appointment. So Facial Palsy UK is really an important source of information for patients, but also for clinicians as well. So we have a medical advisory board that I lead, which includes doctors and health professionals from a range of backgrounds. And the aim there is to make sure that the information we give is as accurate and as rounded as possible. So you have neurologists, you have GP, obstetrics and gynecology, because Bell's palsy can happen in pregnancy. We have different surgical specialties, from eye surgery, ear, nose and throat, neurosurgery, etc. And that's super important because there are over 50 causes of facial palsy, and so it's important that we have both comprehensive and accurate information. My other role within the charity is with the trustees who are excellent, is to help set the strategy around those three pillars around information, research and support. On the information side, we're doing a health professionals website, which is going to be tailored to provide information to health professionals, just to make sure that the information they get, again, be up to date and accurate. On the front of the support, one of the things that happened with the pandemic was the need to roll out virtual support groups, and that's been really, really useful, because it enabled people who live a long distance away from the main centres to still get access to that peer support. That's been something that will carry on beyond the pandemic, which has been quite useful. We still rely a lot on donations from individual fundraising to keep the charity going. And that's been a bit of a struggle with the COVID pandemic and people not being able to do the normal things such as cake sales and charity events. But we hope that things will pick up again going forwards.
When I took facial palsy, I was fighting Lyme's disease, which has lots of other horrible things, and I also broke my neck in the middle of it all. So I was quite busy with just learning to cope with all of those other illnesses. There's something I think is important to say that happened. At one point with my neck, I was told I had over 50% chance of never walking again. And I took that news better than you'll never smile again properly, you'll never get your face back, which sounds nuts, but that's how intensely sorry I felt about my face. So in the meantime, I saved money and I flew over to East Grinstead, paid my flights, paid for the private consultation with a specialist physio. And I sat with this beautiful lady called Trina for an hour. And I go to that hospital a lot now for treatment through the NHS. And there's a bench outside her office. And every time I see that bench, I have a complete flashback to that day. Because when I left her room, one, I knew how severe my facial palsy was. I knew what my condition was. I knew why it had happened. I knew what synkinesis was. I knew what my treatments could be. But I also knew how it was never ever going to get better and potentially it was going to get a lot worse. She showed me pictures. She got me to do these facial exercises and she took pictures. And she was so kind and she said, "Do you want to see them?" I said, "Oh yeah, yeah, yeah." And she put them up on the screen and I couldn't get over how much I couldn't do and how grotesque I felt I looked. I also know I'm very lucky. There was nothing going to stop me get to that clinic. There was nothing going to stop me getting the help that I needed. If I needed to go without food, petrol, I'd have done it. But there's a lot of people that don't get this service offered, partly because in Northern Ireland people don't know it exists, so they don't know they can offer it. And also it's expensive. Because I'm lucky enough to get my treatment, I could just down tools. It takes a day or 2 days out of my every couple of months that I have to take off work, travel over to England, get re-triggered, get my treatment, which I'm so grateful for because my eye won't open, the pain is kicking in, and I get some level of symmetry, which I love. And I have had quite a number of surgeries. I've had 5 or 6 surgeries. I've had the facial nerves to my neck severed. Unfortunately, didn't work and grew back because the pain was so severe. And I've had quite a number of surgeries in my eye to help with my blink. I've had weights put in. I've had grafts. I've had eyebrow lifts. Oh, I've lost count. I rock a good black eye. we pulled together ENT consultants, plastic surgeons, ophthalmologists, psychologists, physios in the Royal one evening. And a gentleman called Chris Little from the Alliance Party came, and he invited somebody from the Health and Social Care Board. And everybody spoke. The doctor spoke, some people were close to tears. One doctor said, I removed mutistic neuroma from a man today. I saved his life, but I've given him a life sentence. And I can barely look at him because I can't help him. Everybody in that room was begging for a service for Northern Ireland. It's needed. I had patients there talking, and they read through what the protocol should be, and we were able to prove there and then in the room that I was never offered that. Were you offered that? No, nobody was offered that. So we were told that we would do a joined up approach with the Health and Social Care Board. It was 6 years ago. I have found it incredibly difficult to fight for the cause of facial palsy for Northern Ireland. I've created a Facebook group, Facial Palsy NI, and we have over 150 active members. So when I get told by the medical profession there isn't a need for this, I haven't advertised that Facebook page. And if I did, and when I start to, as what happened in East Grinstead, the doors opened and they were inundated with people that are living with this permanent condition. And I'm frustrated that this has never really properly been dealt with. I hope that we're at the start of something, but the speed is very, very slow, and NHS the way it is, different priorities take precedent, which I understand. But there's a lot of people out there suffering right now that one person and the group of people that offer support, it's too much for them, and I just wish more people could be helped. I decided to, make this my personal crusade or mission in life, was a two-tiered approach. The first one is that everybody in Northern Ireland should be offered the same service that you do in England. Facial palsy is really difficult to live with, and we need the medical professionals to fully be able to treat this condition the correct way. As I've mentioned before, I was completely told that I would get better, you get better, you get better, you get better, and they went, no, you're never getting better. What? It was the first time anybody had told me that was going to happen, and my life just crumbled. And that was it. There was no support, there was nothing. So I would love to create within Northern Ireland a facial palsy multidisciplinary clinic that has got trained specialists in there who really know what it's like and know what they're doing and know how to treat it. The second reason for doing this is education, and it's education of the medical field, of what it really feels like to have this condition. And I don't know if it's because a lot of patients, they see a lot of patients maybe with Bell's palsy and they see a lot of people get better, so it's kind of dismissive. But my worst days have always been when I'm sitting with a medical professional. I have paid private, I have done everything to sit in front of somebody that knows, or I think they know what they're talking about. And they've said, I don't know what your problem is, you nearly look normal. And I have a list, my arm long, of comments that people have been told or said. I would love to educate people on not just what it looks like, but what it feels like, how difficult it is to see, the constant pain, the nerve pain, the difficulty to speak, the difficulty to hear, the headaches, the rigmarole getting into bed at night to strap your eye down on cue as I push my eye down. I think once we get doctors and nurses and physios and psychologists and ophthalmologists to fully understand what it is like to live with the condition, being physical as well as mental, that they have to be sympathetic and have an understanding of what the condition could do, then I'll put down my warrior sword on this.
My name's Roy, and I have facial palsy.
Hi, I'm Joanne Banting Wimpany, and I have hemifacial spasms, facial palsy.
My name is Wynne Gracie, and I have Bell's palsy.
Hi, my name's Lisa Smith, and my son Jamie was born with facial palsy.
Hello, my name is Janet Robb, and I have had the joy of facial palsy for 9 years.
Hi, my name is Ellen Passmore and I have facial palsy.